A free and cheap healthcare drug guide. Free/low-cost medical care drug guide introduction. There are medical clinics and mobile medical trucks that go around helping people without medical insurance get treatment. The federal government helps indigent people with medical care through Medicaid.gov. Most states help out. They have a state Medicaid office. It's usually a part of their state website. There are NGOs and charitable organizations out there. The drug companies, the National Institute of Health (NIH.gov) and the Food and Drug Administration (FDA.gov) offer drugs to poor people and experimental drugs for studies that they do. Everybody's case is different. Get medical organization websites through nih.gov or at number 610-619 at the library, then find the organizations for your particular illness. Some of the major health organizations offer free or low-cost treatments with either experimental or conventional procedures and drugs, but you have to ask about them. Contact the specific organizations within the National Institute of Health as well as the service organizations for particular illnesses. Chapter 1. Help with medical treatment. Medical assistance info. Much of the medical assistance to low-income people, seniors, and children originates from Medicare, medicare.gov/publications/pub/pdf. For medical assistance programs from local and state governments, try their Department of Social Services. For most medical assistance from the state governments, the keywords I've seen are low income and medical assistance, so you either go to the general website of your state government or its medical website, Department of Health, which is somewhere in this book, and type the term medical assistance into it. Ways to save money on medical treatment. You can hope that you don't get sick, but there's always a chance you'll get into an accident. You could go to the ER and get a bill or try other things. Many big box stores are opening small medical urgent care centers that will diagnose your illness and let you know if it's something minor or serious. Typically these places are staffed by nurse practitioners or doctors. The price is under $100. The big department stores offer cheap prices on generic prescription drugs. Ask your doctor for a generic version of your prescription drugs if there are any. Get all diagnostic tests done privately and not at the hospital. Hospital emergency rooms are more expensive than a trip to the family doctor. Try to avoid the hospital on weekends. If your surgery doesn't require an overnight hospital stay, get it done on an outpatient basis. Many people think that ambulances are free or covered by insurance, but it is up to the insurance company to decide if your case is a true emergency and whether or not it will be covered by your policy. Consider going to a nurse practitioner. They are cheaper than a traditional MD. There are prescription drug coupons around. Prevention through good health is best. If you have a specific disease, check with foundations and organizations focused on your disease or illness. Catastrophic health insurance covers you for major expenses, such as those in a car accident. You can buy a personal or family catastrophic health insurance plan with a high deductible. If you're healthy and have no pre-existing conditions, buy your own insurance with a licensed insurance agent in your state. There are some companies that will only give you headaches. A high deductible policy isn't very expensive and it's better than having no insurance at all. If you have children, it may be possible to buy inexpensive insurance through their schools. Find a clinic that works on a sliding scale fee structure. If you don't have one in your area, call your regular doctor to see what you can work out. Eat right, get enough sleep and be careful. The best way to save money on healthcare is to not get sick. Check and see if your local medical school has a clinic. These are typically low cost to free, to give the medical students an opportunity to practice. This works in a variety of areas like physician's assistant programs, dental programs, chiropractic programs, etc. Some states have programs to insure children who have no health insurance. It is possible to get individual insurance with a pre-existing condition, but you need to shop around. Never lie about your health. If you don't disclose a problem, they can reject your insurance at a later time and leave you with the bill. Some counties have school-based health clinics in the school for kids for free even if the family has health insurance. Shop around for the best health plan. Consider a high deductible, HD, plan. It might work well, especially if you have a health savings account, HSA, too. Bring a list of covered prescription medications to your doctor so that he prescribes those drugs for you. Ask your doctor to write out a prescription for the generic version. Get routine checkups to find problems early. Wear helmet and protective gear when playing sports or working. Ask your doctor for drug samples that the drug companies provide. Wash your hands often to avoid catching diseases. Don't buy supplements. Most of them are a waste of money. Compare prices for prescription eyeglasses and contact lenses. Take care of your teeth. Bad teeth allow bacteria to get into the body. Read your medical bills carefully. Compare your bills to the explanation of benefits, EOB. Go to a dental school for cheaper dental treatment. If your insurance plan denies your claim, appeal the decision. Contact your state insurance commission to complain. Choose your hospital. There's a difference in what hospitals charge. If you're well enough, ask a friend to fill the hospital prescription at an outside pharmacy rather than have the hospital do it since it's cheaper there. Some hospitals charge $50 to $100 just to fill out admittance forms. Ask to fill them out yourself. A study done by the U.S. General Accounting Office found that 99% of all hospital bills are in error against the patient. If you have a large bill, find a bill auditing service to go over it. Instead of a hospital emergency room, try a smaller emergency medical clinic. Look them up in the Yellow Pages or National Association of Ambulatory Care. 612-476-0015. Try to avoid checking into a hospital for something minor before a weekend, then having to stay over the weekend and paying those hospital rates. Don't let the hospital repeat tests you've already had. Watch out for duplicate billings of the same test. Don't pay for shoddy X-rays. Specify beforehand that you want the option of approving all medical tests. If you see a broad heading on your bill like radiology or pharmacy, ask for a more specific breakdown. Don't assume your doctor will recommend the cheapest option. You have to ask questions. Most doctors won't volunteer billing costs unless you ask them. Ask if they have a list of costs for standard procedures, just like a restaurant menu. If you're not covered or only partially covered, go for a general practitioner for general needs rather than to an overqualified doctor with board certification. Doctors can be either cheap or expensive, so shop around. Avoid the annual medical exam unless you're sick. If your benefits are denied, fight back. Read the fine print of your policy to know exactly what you're covered for and where, like out of state or out of country. Be wary of buying policies from small or new companies that could go bust and leave you hanging. File claims promptly. Keep all records. To save money, raise the deductibles. Some of the major health organizations offer free or low-cost treatments with either experimental or conventional procedures and drugs, but you have to ask about them. Contact the specific organizations within the National Institute of Health as well as the service organizations for particular illnesses. Reduce medical costs/reduce dental costs. You can negotiate for healthcare services. Call and ask what the procedure will cost at several hospitals. You can go to Mexico, India, etc., and pay a flat fee, which is usually quite low for a medical procedure. It's called medical tourism. If you smoke, stop. You'll eliminate heart, lung, and circulatory problems. Excessive alcohol is bad for you. Cut down or stop drinking entirely. Ask your doctor for starter samples of drugs he may prescribe for you. By law, all aspirin is the same. Always buy the cheapest brand. If your doctor writes a prescription for a brand name drug, ask the pharmacist to substitute a less expensive generic drug. Most prescription drugs may be ordered from mail-order pharmacies licensed by the state. Ask your doctor, pharmacist, or hospital for the names and addresses of such firms. This is a great saving for non-emergency drugs. Many Americans buy cheaper drugs from Canadian pharmaceutical companies by mail order. Just make sure it's an honest company not selling counterfeit drugs. If you live near the border, take a bus trip over. Buy the store brand of a medical product. It's often made by the same manufacturer. Question whether procedures are necessary. Sometimes, it is cheaper to buy 50 mg tablets and split them into half than to buy 25 mg tablets. They sell pill splitters for under $10. Check the expiration dates of any over-the-counter medication you buy and choose the package with the latest expiration date. Check public health centers in your area. They usually give immunizations and routine screening tests free of charge or for very little cost. Buy a good home medical guide like this one. Learn to recognize symptoms of diseases. If you have a persistent problem, get it taken care of as soon as possible. Record all medical expenses for tax deductions. If possible, use outpatient facilities for minor operations and medical procedures if it is acceptable to you and your doctor. Have physical examinations regularly in order to catch problems that could get much worse. For minor surgery, ask your doctor if it can be done in his office. If hospitalization is necessary, have all tests done before you enter. Discuss your financial situation with your doctor, especially before surgery. He may be able to suggest savings. To save on hospital costs, get in and out as quickly as possible. Before you enter, be aware of what everything will cost and cut out the frills. Shop around first, then join the best healthcare plan you can afford. If a doctor claims you require surgery, get a second opinion. A second MD may know of a non-surgical treatment that works. Investigate any health insurance organizations in your area. These are groups of doctors who offer you all the health care you need in a year for a single predetermined fee. Check your phone book. Medical schools that train optometrists and podiatrists operate low-cost clinics. These clinics are open to anyone. Senior citizens who join the American Association of Retired People, AARP.org, get drug discounts. Home health care is sometimes possible in lieu of a hospital stay after a surgery or treatment. Discuss it with your doctor and you may shorten your hospital stay. If you are in bad financial straits, you may be eligible for Medicaid. Your local Department of Social Services can give you information. Keep your own accurate and up-to-date medical history records. Many large corporations arrange for their employees to get free or low-cost medical and dental care and medicine. When visiting your doctor, bring along a list of questions you want to ask. If you have minor medical problems, phone your doctor. Don't visit him. Buy drug items from discount stores where they are less expensive. Observe and teach all family members good dental hygiene. Visit your dentist regularly for checkups. Emergency room treatment, the law. Under federal law, a hospital cannot refuse you in an emergency for any reason even if you can't pay. Federal law mandates that any hospital or clinic must initially screen and stabilize anyone that comes seeking treatment rather than ship them off to another facility immediately. If they fail to do this, they are breaking federal law and can be charged with malpractice and ultimately kicked out of the Medicare program. If you have any problems regarding emergency medical treatment, complain to the Healthcare Financing Administration. Healthcare Financing Administration, HCFA. Healthcare Financing Administration, HCFA. Department of Health and Human Services. 6325 Security Boulevard, Baltimore, Maryland 21207. 800-638-6833, Medicare Helpline. hcfa.gov, cms.hhs.gov. Regional HCFA offices. JFK Federal Building, Boston, Massachusetts 02203. 617-565-1188. 26 Federal Plaza, J.K. Javits Federal Building, NYC 10278. 212-264-4488. 3535 Market St. Gateway Building, Philadelphia, Pennsylvania 19101. 215-596-1351. 101 Marietta Tower, Atlanta, Georgia 30323. 404-331-2329. 105 West Adams St. Chicago, Illinois 60603. 312-886-6432. 1200 Main Tower Building, Dallas, Texas 75202. 214-767-6427. 601 East 12th St. Federal Building, KC, Missouri 64106. 816-426-5233. 1961 Stout St. Federal Office Building, Denver, Colorado 80294. 303-844-2111. 75 Hawthorne St. SF, California 94105. 415-744-3502. 2201 6th Avenue, Blanchard Plaza, MSRX 40. Seattle, Washington 98121. 206-553-0425. Chapter 2. Financial help with medical treatment. Illness is expensive, even if you're rich or have high. Even if you have health insurance, you might not have drug coverage, you might have to buy medical treatments, doctors gouge you any way they can with extra treatments, etc. If you live out of town, you have to stay at a hotel or B&B if you're going in for surgery and treatment. For hospital bills, you could talk with a hospital financial counselor. You may be able to work out a payment plan or get a reduced rate if you plead poverty and hardship. Insurance companies are notorious for ripping people off so much that there are now professional patient advocates and lawyers that help you fight your health insurance company if they try to reduce your benefits or deny them. Go to cancer.gov, search for financial assistance or call them at 1-800-4CANCER, 1-800-422-6237, to ask for help. You should create a simple advance directive, which is a legal document that lets you decide how much treatment to receive if you're dying. A living will is a different legal document that lets people know what kind of medical care you want if you go into a coma or something like medical incapacitation. A durable power of attorney for healthcare lets a person to make medical decisions for you if you can't make them. This person, chosen by you, the patient, is called a healthcare proxy. A will tells how the executor who you appoint how to dispose of your assets after death. A trust appoints a manager to manage money while you're alive or dead. A power of attorney is a legal form that appoints a person to make financial decisions for you. You don't need a lawyer to fill out these papers. It's easy to find these free forms online, print them out and fill them in. Get a witness or a notary public. Each state has its own laws about advance directives. Get free medical care. Look up free medical clinics, free dental clinics and free medical help at citysearch.com. Find the medical schools in your area, send them an email asking about free medical treatment. Try community health in your local phone book.